Welcome to Auditory Hallucinations, Hearing Voices, presented by the Colorado Behavioral Health Administration. In this 7-minute course, you'll deepen your understanding of hallucinations and learn about strategies that may be useful with individuals who may be hearing voices when you encounter them in your role as a first responder. After completing this course, you may have the opportunity to participate in a facilitator-led, problem-based learning activity that will help you apply the information covered during this brief learning event. This activity would be held back at your station or office and likely led by a department trainer or supervisor. Take a moment to review the course objectives listed here.
Hello, is anyone there? Mrs. Hernandez?
It's the sheriff's office. Just checking on you. Your neighbor called and said she was worried about you. And you didn't respond when she came over and knocked on your door.
No.
Excuse me, sir?
No, that won't happen. Stop it.
Sir, we're here to check on Mrs. Hernandez. A neighbor called about her. Is Mrs. Hernandez home?
I said stop it. I'm tired of listening to all of you.
We need to check on Mrs. Hernandez. May we come inside?
I don't know where to go. Where do I go?
Auditory hallucinations are different from having an internal monologue, which is when you hear your own thoughts in your mind as if you were talking to yourself. Hearing voices refers to hearing other people's voices that aren't actually there. It's estimated that approximately 5 to 15% of the population hears voices at some point in their lives, though not necessarily frequently or over long periods of time. Auditory hallucinations may or may not be associated with mental illness. Hearing voices can occur in individuals with no mental illness, and the experience can be shaped by the person's environment and life experiences. Hearing voices is often associated with schizophrenia because approximately 70% of people with schizophrenia report hearing voices. However, only 1% of the population has schizophrenia, so the majority of people who report hearing voices at some point in their lives do not have schizophrenia. Some hallucinations are nonverbal, with sounds such as clicking, ringing, or music. Many, however, are verbal, involving one or more human voices. The voices may be associated with someone the hearer knows or imagines, or they may not be attached to a person or character. In some cases, the voice or voices may be critical, saying mean or insulting things, or the voice may give ongoing commentary, such as describing what the hearer is doing. Some voices may be friendly or neutral, saying either sensible or nonsensical things. Sometimes, individuals may hear scary or threatening voices, such as those telling them that bad things will happen. People may also hear multiple voices arguing either with them or with each other. Some people experience command hallucinations, or a voice telling them to do something. Sometimes the commands are to do harmless things, but there are situations in which people hear commands to harm themselves, which is more common, or to harm others. Most people who hear command hallucinations are able to resist the commands, although they are more likely to obey commands to self-harm rather than to harm others. The voices may directly address the hearer, seem like background noise, or be directed toward others. The voices may be perceived as coming from within their own head or from various locations in the environment. Also, be aware that the voices and types of hallucinations may change frequently. People may hear all 6 types of verbal hallucinations we have listed here within a matter of minutes, with multiple and alternating voices involved. Factors that may influence hearing voices include stress, worry, or grief, lack of sleep, especially if it is chronic, extreme hunger, traumatic brain injuries, taking recreational drugs or as a side effect of prescribed drugs, traumatic life experiences, and mental health conditions such as schizophrenia, bipolar disorder, or severe depression. However, there's much that is unknown about hearing voices, and not everyone who hears voices may be affected by these factors. A person's culture can have an impact on the experience of hearing voices, the types of voices heard, and the meaning attributed by the voice hearer. For example, people in some cultures are more likely to hear critical voices, and those in other cultures are more likely to hear voices of a spiritual or religious nature. Because of these factors and others, the voices may or may not be distressing to the hearer. The impact may be influenced by the presence of other symptoms. The type of auditory hallucination, frequency, and intensity have an impact. Finally, the extent to which the person is disconnected from reality is an important factor. If the voices occur in the presence of other symptoms of psychosis, the individual is less likely to be able to cope with the voices or resist them. Common impacts of hearing voices include difficulty concentrating and communicating, difficulty sleeping, disorganized thinking or speech, irritability, a tendency to isolate from others, and difficulty expressing emotions. Hearing voices may occur in the presence of other hallucinations or delusions, including paranoid delusions. This may include delusions about authority figures, such as law enforcement or people working for the government. This is particularly likely in people with psychotic illness. In these cases, the individual may be fearful of anyone wearing a uniform. Let's take a moment to think about the experience of paranoid delusions. Think about a movie you've seen that was very frightening. Remember the feeling that something bad was going to happen and how the clues mounted to indicate what might be about to happen. Remember the feeling of sitting on the edge of your seat with the tension mounting, just waiting for something bad to happen. In the movie, something bad probably did happen, and the tension was discharged. But if you think about the feelings of waiting for a bad thing to happen, perhaps with the clues suggesting it or the narrator or characters telling you that something bad was about to happen, that feeling is what people who experience paranoia feel all the time. And because the tension is never discharged, because the paranoia is delusional, the person may be in a constant state of anxiety. Imagine trying to obey commands or communicate with someone while feeling that tension or anxiety of constantly waiting for something bad to happen. Some strategies that may help to communicate include the following. Use calm, clear, simple language. Speak slowly. Have patience and repeat yourself if needed. Demonstrate empathy. It must be very scary to be hearing voices. Validate their experiences, such as saying, "Sounds like you're hearing someone else talking to you right now. I can understand that. Could you try to talk to me for a few minutes right now, though?" Use visual stimuli if possible, such as photos or drawings on a whiteboard. Check for understanding, such as asking them to summarize what you're saying or what's going on in the situation. Identify the need in the present moment and focus only on that. And try not to touch them without permission if possible. If the person is also experiencing paranoia, they may be very frightened of you, and touching them will likely escalate the situation. Auditory hallucinations can range in type, frequency, and severity. People may vary in the extent to which they are distressed by hearing voices. The impact of auditory hallucinations can be serious, particularly with certain types. Communication with an individual hearing voices can be challenging, but the strategies discussed in the course can help facilitate effective communication. Materials are available to your team to help you explore interactions with individuals hearing voices you may encounter in your role. Thank you for taking the time to learn more about this topic. Close this browser tab to exit the course.